I'm going to give a brief description of a breast lift or mastopexy. This is a common reason for consultation. Very commonly, patients complain of sagging after breastfeeding, after weight loss, or with aging. When we evaluate patients, we have to look at their overall breast health, and if they're over 40, we need a mammogram. Often patients who think they have sagging breasts just have deflated breasts, and with an implant alone may not need to have any kind of breast lift. The advantage of using the Chrysalix is able to preview for a patient what implants alone would look like. There are some patients who come in complaining of sagging, but upon further discussion we discover they have back, neck, and shoulder pain, which is an indication of their breasts being too large and they need a breast reduction, not a breast lift. There are 3 types of breast lifts that we do. It depends on how much sagging patients have. The most common one is a vertical or lollipop incision, is used for patients with sagging for up to 4 inches from the ideal position. The second most common one we use is a full anchor incision for patients who have sagging beyond 4 inches. And rarely we use the periareolar incision for patients who have sagging for only up to 1.5 inches. Very often patients do not have enough breast tissue, and with doing a lift they may appear to be 1 cup size smaller than where they started. Breast lifts are often combined with implants. If not, we need to move tissue around because there's lack of tissue at the upper part of the breast, and with moving of the tissue is another reason why the breasts may appear to be slightly smaller. There is some removal of skin with the procedure, and that also will cause some loss of volume. Scars are at their worst 4 to 6 weeks after surgery and fade over several months, but there will always be a scar. Fortunately, there is minimal discomfort because it is breast tissue and skin only that we are dealing with.